this week's mob is going to be a kind of knee first aid mob. It's not going to really solve the problem, but it's going to give you enough slack on that knee that you can start solving your problem. So let's say you have a little bit of tendinitis going on, or you're just feeling that knee, it gets just slightly swollen. Not quite sure where it is, but you feel it's nothing too serious. Now, the first thing you need to think about is, what's happening with my hip, what's happening with my ankle? Do I have the full range of motion required in there? Or is my knee taking a beating in between? Next thing you're going to think about is, what about the muscles around the area? My quads, my hamstrings, adductors, all these muscle groups down the leg as well. Are they tight or are they nice and free? If they're not, you need to address that. But apart from those things, let's start to think a little bit about first aid. 3 things. First one is going to be just a little bit of traction. This is going to be good for your ankle and hip as well. Just setting up a band relatively high up on the pull-up rig or wherever you want to set it up. You're going to sit down. You're going to bring your heel behind, bring the band behind your heel. Then you're going to cross it in the front, bring it as close to your ankle as possible. You're going to lean back. You can just relax. You're getting a little bit of traction on that. You can do little flexion extension cycles. And that. Or you can just rotate the hip, or you can just relax in that position. You're going to spend about 2 minutes in here. If you start to have tingling in your toes, it's probably a sign that you should stop. Okay? So that's number 1. Number 2, you could just go into mold the joint capsule. Well, that's what we think we're doing at least. Who knows what's really happening. You're going to use your forearm, so the thicker your forearm, the better the mold. You're going to bend this knee, bring the forearm, the thickest part behind the knee. You're going to do a little rear naked choke on your own knee. And you're going to cross the foot with the opposite foot. Now you can lie on your back. And you can just do these little pumps in here to start to loosen off the joint. And again, maybe 20, 30 reps max. Make sure it feels relatively comfortable. It shouldn't be painful. Once you've done that, the last mob is going to be with a crossbar. I'm going to address that synovial pouch just above the knee joint. So the ball, if you find your kneecap, you put the ball just above that kneecap. Lie on your front. Put the pressure in that direction, so you're pushing the ball kind of up and down, or up in this direction. Bend the knee a little bit, find that area that feels a little bit tight, bring the knee straight again with a little bit of pressure, and now you can rotate 15, 20 reps, and you can pump that knee. Anything up to 50 reps or more is going to be okay. And just spend some time in there trying to loosen off if you have some tight spots around that knee. And then the test, retest, if you want to do it, is going to be a squat. When you squat down, you should see that that knee is now resting further back than the other side. I can compress it further and go further into flexion. That's it.